I'm a mom. I have two kids, 4.5 and 2, and they keep me extremely busy. So as a mom, I am juggling a lot of plates in the air and trying to be a successful physical therapist that can really give back to both my patients in the sense of trying to fix their pain and resolve that as much as I can, but also trying to work on some of those more minute details. How well can you avoid an injury? How well can you perform in maybe some of your activities that you love to do, whether it's cycling, running, or getting back into a sport? My name is Megan Holmberg. I'm a physical therapist that I've been practicing for almost 11 years. I've been a part of the Momenta team for almost 3 years and have really enjoyed every aspect of it, but particularly just combining with the Pilates instructors, the personal trainers, and the massage therapists to make a holistic and whole body approach.
How tough is it to be a mom and a physical therapist?
It's pretty tough. It is not an easy experience, but it's a very rewarding one, particularly now that I'm part of the Momenta team, because we have such a great ability to transition from physical therapy into personal training and kind of go back and forth as our patients and clients need a specific intervention.
How did you get started with physical therapy?
I've had a lot of experience in physical therapy personally. Started pretty young. I think if I probably added up all my time, even just in an adolescent phase, I've probably done over 1.5 years of physical therapy personally. And then actually was more interested in orthopedic surgery and actually studied for MCAT and took MCAT, but decided to go the physical therapy route because I was working in a physical therapy clinic at the time, and I really liked, quite frankly, their work-life balance and how much time they spent with their patients, which I knew I would miss in medicine.
What's the most exciting thing for you when it comes to physical therapy?
Oh, that's a hard question. The most exciting is when I, honestly, as cheesy as it is, when I see the pure joy on my patient's face when they've actually achieved something that they honestly didn't think that they could do, or that they see a massive shift in how their body's performing. That is extremely rewarding for me because I really just want my patients to be happy and have a quality of life that, quite frankly, we all deserve, but probably don't get just given today's society of how much we sit in an office or drive in a car.
What's your advice for somebody getting started in the gym?
That's a great question. I think it depends on what state of fitness they are in, and also whether they have any aches or pains, whether it's chronic or acute. My biggest advice to somebody who's starting out in the gym is just making sure that they have some really good people on their team. And so looking at form, because a lot of times our brains are so smart that it does a more efficient pattern of movement rather than a quality pattern of movement, and recognizing what that quality pattern might look like. So whether it's through your trainer or just getting an assessment from a physical therapist to make sure that you are having really good movement patterns is a great way to make sure that you're doing what you're trying to achieve and also avoiding injury. Today's society is very reactive to pain, so a lot of people think about a physical therapist well after they probably should have been in physical therapy. I think people should consider going to physical therapy, quite frankly, even when they feel good, but just are having difficulty maybe achieving a certain movement pattern or having tightness that just isn't going away with their current method. So coming to physical therapy can look like, yes, I have pain, but it also may be just to improve your motor control. It may be to improve your mobility. We can address it through dry needling. We can address it through soft tissue techniques, cupping, joint mobilizations, and most importantly, postural awareness. The amount of people who really don't have great posture and then try to go lift, overhead activities or squat pattern is a mess because they just don't have the same awareness in their body. It's a great reason to go to a physical therapist, get that teased out, because while your trainer may be the best in the business, it's important that we're looking at a little bit more minute details that sometimes can only be achieved in physical therapy. So great way to contact me is either to text or call my work cell phone number, which is 720-467-8819, if I remember it correctly. So that is the best way to reach me. I should also mention that I have a certification for both post-concussive evaluation and treatment. And I also tend to work a lot with headache population as well. And then I often do a lot of work with some of my adolescent athletes to work on a lot of motor control and avoid chronic or recurrent pain.